Well, welcome everyone. My name is Bryan. I'm with Nava, and I've been stoked about this session for a while because this is a topic that I know personally, at least in my career, and I imagine many of you have had this issue before. I've laid awake at night wondering how to solve this particular problem, and I think the problem statement that we're working with is how do we level up the quality of our health plan in a rising cost environment. And as Brandon mentioned in the keynote, over the last decade, most employers have seen their costs double in many cases. And over the last couple of years, we've actually seen that rate of increase start to accelerate as healthcare trend has started to increase. And I don't think there's any argument with, now is the time to really start thinking about different ways of attacking this kind of age-old problem of cost versus quality. So I am delighted to be on stage with three amazing innovators who are really thinking about this problem in different ways, whether it's how we think about risk inside of our health plan, whether it's how we use data to help make better decisions, or even just the structure of our program and how we offer it. Just new, exciting, unique ways to actually solve a problem that's been going on for a really, really long time. So with that, I'm going to dive in. We've got a lot of great topics kind of underneath this subject to go through. A few of them might be a little bit spicy, so we're going to kind of gauge the spice level as we get through this. But I'd love it if each of you could just take a moment, introduce yourself, talk a little about your organization, and we'll dive in. Kristen, maybe we'll start with you on the end.
Sounds good. Can everyone hear me okay?
Yep.
All right. I'll try not to bop my mic again. I'm not used to usually sitting. I usually move around when I talk, so we'll see how this works out. My name is Kristen Rivers. I am a Senior Vice President of Sales for Pareto Health. I've been with Pareto for a little over 4 years, and prior to that, I was with United Health Group for 14 years, and in the pharmaceutical space prior to that, and I'm a recovering lawyer, so I think I got every hated industry and company covered off there before coming to the right side of things. I'll share some of my story kind of lends into what we do as a company. So I'll talk a little bit about my background. When I was at United, one of my favorite jobs was being in production and selling. Loved the hunt, loved the win. Why they thought it was a good idea to put a lawyer in a sales role, I don't know, but I was good at it. And I got to work with very large companies, national account size customers, 10,000 plus employees. And we really got to use their benefits as a way to solve for their business needs. As you start to come what we call in our industry down market, so employers that are smaller, maybe in the under 1,000, under 2,000 employee space, all of the options that you have available to you from a benefits perspective are off the shelf. They're dictated by the carrier. You have to pick between offering rich benefits and saving money for your organization. And that problem's gotten harder and harder. And in kind of looking to what my next step was going to be, if you want to continue to move up in a company like United Health Group, you have to have your moral compass and value system align with theirs. And to me, my career was just taking off. It wasn't where I wanted to end or sunset my career, and I didn't align with their value system. So I moved over. I got to know our founders, and I ended up moving over to Pareto, and we get to help employers of all sizes take control of their healthcare spend and self-fund safely. And in parallel to that, we're also able to give them the solutions that only the largest companies in the world have to really not only help them save, but also enhance their benefits.
Great, thanks.
Awesome, thank you. I'm Chad Schneider, the head of the brokerage channel at Thatch. I've been in the industry for about 24 years, and similar, I started on the voluntary benefits side. So when VB was not cool 20-some years ago, and I started to break in, that's what we were pioneering at the time. And my journey has been helping employees with their healthcare journey just from day one, and just to be able to see voluntary benefits and now all these different alternatives. I was with a financial wellness company for a number of years, being able to help people understand finance, and instead of just saying, here's money in a 401k, what do I do? How do I actually do better? How do I actually use these dollars to give me the empowerment to do better? And I was at Jellyvision and built their broker team. So in terms of the healthcare navigation, what's an HMO, what's a PPO, all these employees that are I don't know, I have one or two choices and I actually don't know how to choose this type of stuff. So that led me to Thatch, and the founder actually got connected through a mutual friend, and he started talking about ICHRA, and I was like, what the hell is an ICHRA? I was like, it's a terrible name, first off. Let's change that. And then all of a sudden we started diving in. And I was like, wow, this is actually really, really amazing. So I've been here for about a year and a half, lead the broker channel and working with great partners like Nava and be able to now make sure people understand what this actually means. And so what is an ICHRA? In fact, how many of you have even heard the term ICHRA before? All right, so about half of you, that's great. So it's an individual coverage, health reimbursement arrangement, and effectively, it didn't really even come into until 2020, so it's only like 5.5 years in. And really what it comes down to is it's allowing you to drop group health coverage and now you provide an allowance to an employee to go buy whatever health insurance that they want. So it's literally saying, employee, go buy your own individual coverage, which I know sounds crazy, and we'll talk about a lot more detail about that, but that's really the whole idea, is empowering employee to really, we talk about consumer-driven health, but then we still give everybody one choice or two choices, where it's like, how do we actually tell these employees to take advantage and actually go in and research doctors and all that type of stuff. And that's the whole mission at Thatch, our mission literally to build a healthcare system that people love, because let's face it, people do not love the healthcare system right now. So excited to be here and looking forward to it.
Great, thanks, Chad.
Hello, everyone. My name is Fereshteh Dastyar. I have the fun name of the group today. Don't worry, when I go to Starbucks, I tell them my name is Sarah, and I get my coffee a lot faster that way, so feel free to call me Sarah today. I am Vice President of Strategic Alliances at Garner Health. That's a really fancy way of saying consultant relations. I've been at Garner about 2 years, but I have been in the healthcare space for just under 30. I don't want to age myself, but closer to 28, 29 years. I started off working with the hospital systems, and then I moved over to a carrier. I worked at Anthem for a few years, and then I was a consultant for over 10 years. And then now I've been in the consultant relations space working at Garner. What Garner is, it's a healthcare, health data technology company. We have over 75% of all the claims data out there, over 320 million patient records. And what we do with this data is we look at the data and we evaluate physician performance. We look at quality, we look at cost, and then we say, okay, across 82 subspecialties, so pretty much everything from PCP, dermatology, mental health, through oncology, radiology, you name it, we're evaluating physician performance, and we marry that data with an incentive that drives people to use Garner and to get to the better physicians to get better healthcare outcomes, which is what we're all here to do today. So I'm really excited to be a part of today's panel, and thanks for having me.
Great, thank you. So let's start with talking about the cost side of this equation. When I started, not to date myself, 25 plus years ago, the buzzword was bending the cost curve. And fast forward 25 years, the buzzword is now still bending the cost curve. And I think we've had, as an industry, kind of limited success in doing that, if we're being honest, over the years. I mean, Brandon mentioned earlier the cost of healthcare has doubled over the last decade. What in this moment right now gives you optimism around our ability to actually do that going forward? Kristen, I'll start with you.
Yeah, bending the cost curve, that's what we're all here trying to do, right? And I think over the past 20 years, if you think about bending the cost curve, we've really focused on the member behavior. So we've increased the deductible, we've given them wellness apps, we've given them shopper tools, and it's kind of failed because the member is not the provider, they're not the doctor, they're not the ones that's setting the costs for the surgery, as an example. So what gives me optimism today about what we could be doing differently is the fact that we now have access to provider-level data. So today, we now have NPI-level data. And that data is allowing us to see which providers are actually providing better healthcare value, which ones have better cost and quality, which ones do not. And so with that, I think that the shift has now been from changing it from it being on the member side, fixing the member or the patient, to now fixing the referral. And I think that is where I'm really optimistic about where it's headed in the future.
Thank you. Chad?
I mean, I think this panel right here, it wouldn't exist 10 years ago, right? The ability to be able to put the actual data in the consumer's hand and, if you win the consumer, you win the healthcare, right? Because they have had zero ability to be able to make that choice. There was an old stat during open enrollment, the average employee spends like 8 minutes, going through the entire open enrollment journey, which is insane. It's the biggest healthcare spend. It's probably the biggest spend in their entire paycheck, and 8 minutes to pick a plan. And but they spend 4 hours buying a TV. Spend 2 weeks, planning a vacation, but then when it comes to their actual healthcare, it's like 8 minutes, and that's fundamentally wrong. So how do we actually help people? They say, great, like find the right doctors, find the right path, find the right navigation, and be able to really understand that whole journey. So the fact that there are tools and there's data and there's more consumer-driven aspect, and guys like Mark Cuban are out there yelling and screaming and shaming PBMs. I love that, and that wouldn't have happened 10 years ago. So what gives me optimism is panels like this and more people coming out with innovative every single day. Yeah.
Is it time to start chanting "break them up"? Yeah.
Yeah.
It's interesting because healthcare spend is a financial cancer that's metastasizing inside of all of your organizations today. And I'll get to the optimism, I promise. And for so long, no one wants to talk about health insurance. We in the benefits space have had a history of aggrandizing how important it is. But it's getting to a point of being so unsustainable that we're hitting that watershed moment. Organizations like yours are hitting that damn it moment and saying, we have to do this differently. And there are so many solutions out there coming to market. This panel, your Nava team has things at their fingertips for you to really help you take control and do things differently. I wouldn't even call it a spotlight. There isn't a spotlight on the organization. The lights are on, and they're not going to be turned off. And there's a lot of good actors in the space that are helping move the needle to help companies such as yours.
Yeah, thank you. And so on the flip side of that, if we go through optimism, let's talk a little about pessimism for a second. What do we think the barriers, like the biggest barriers to actually bending that cost curve are from your perspectives? Chad, maybe start with you.
There's almost too many decisions to make now.
Yeah.
Like the last panel, it's like, how do I pick all of these different solutions? Yeah. I only have so much budget, getting pressure from the CFO. The board of directors, who literally never asked about benefits in the history of ever, is now finally asking these questions. And then it becomes a little bit of like analysis paralysis, where, let's face it, you have this whole cycle, 12 months. It takes, you have open enrollment, and then 4 months later, you're already starting the new cycle, and you're trying to actually figure out, like, what do I do? How do I do it? Oh, wait, when are rates coming out? Oh, wait, now I have to, analyze, are the employees happy? I have to do surveys. And again, you're picking 1 or 2 plans for hundreds of people to be able to figure out what they are looking at. So I think that's the negative part, is like actually planning enough and to be able to give yourself enough time and breathing room to be able to say, if I want to do something different, how do I actually do that? Because it's all last minute stuff, right? We're getting we have this renewal coming up. Can you do this in 3 days? Where it's like, no, we can't. Let's start this time, next year, so we can actually plan for like a year from now. So I think that's the part that we all have to, which is, it's not easy, obviously. Like that's what we have to start a little bit, better planning. And if we were to say, be courageous enough to break the mold and say, I have to do something differently. It might not work perfect, but is what you're doing today working perfect? I think that's the other piece, to look in the mirror a little bit too. Yeah.
Fereshteh, maybe what you have a take on that?
I keep thinking of everything from like a data perspective. I think historically what we've always been doing is looking at it from a unit cost perspective, right? Now, the problem with that, in my opinion, is that when you're looking at it from a unit cost perspective, let's just say a carrier goes and negotiates 50% for a procedure that cost $100,000. If you never needed that procedure to begin with, you actually just wasted $50,000. So the barrier to me is changing the narrative and the discussion point of what is the price per service to how do we get people to the best providers with the better outcome for the total episode of care. And to me, that is where I would like to see us focus more on.
I'd probably distill it down to 3 categories. The first being inertia. It's easy to do things the way they've always been done, and there's comfort in that, right? And the legacy models have been set up to support that, right? It's easy. What is the highest increase we're willing to take or that we're budgeted before, where we can just agree and move on till the next 12 months and the apologies tour starts again. The second piece being misaligned incentives in the system, right? Those legacy models are built to drive incentives and costs in themselves. They're not incentivized to help reduce healthcare costs. They're incentivized to increase them. And the last piece being the lack of transparency. Most of those models never give you data. You don't know what your drivers of your claims are. You can't measure or do anything about the things that you can't see. And the system's working the way it's designed to work to keep those three things, to keep employers such as yourselves in the same model.
So much to unpack there, like a million follow-up questions.
Need 2 more hours.
I know, right? So Chad, you talked a little bit about sort of what I would maybe paraphrase as like kind of the change management element of like folks trying to make these decisions with alternate programs. What, from your perspectives, are the hardest parts about that change management process for employers who are looking to move into an alternate funding arrangement, alternate type of health plan strategy? First, maybe I'll start with you.
There are so many factors there to uncover. I think that when you're thinking about alternate plan designs, there are levers that you need to be thinking about and pulling. And to Kristen's point, data is key. Understanding where that data is coming from, what is that data saying, and then looking a few levels in more detail about that. So if you don't know what you're solving for, you can't solve the problem. And I think that's where we're all kind of stuck, is we don't know how to solve that problem. So when you're looking at alternate plan design, what are you trying to solve for? What is it that you're trying to get to? And how then do you use that to step up and get to that next level?
So I look at it, how many of you still offer a pension to your employees? Right. So 25 years ago, that was the mainstay, right? You offered a pension, you would say, great, this is your retirement, we're gonna make the investments for you. And employees were like, great, I think this is how this is supposed to work. I'll get the golden watch in 20, 30 years and I'll sail off into the sunset. And then the employees started saying, wait, I don't want you making investments for me. I want to pick what I want to invest in. I have a different risk profile. I want to be able to look at different types of growth or risk mitigation. And so this is exactly what's happening with ICHRA. We are basically the same exact thing from a health standpoint. Instead of you picking the plan for your employee, you give them a defined contribution and say, you pick your own plan. The 26-year-old is going to have a very, very, very different aspect of health than the 55-year-old. And so, what is healthcare to you? The 26-year-old tech employee might say a pre-novo body scan is healthcare. The 55-year-old with a spouse and 3 kids is going to have a whole different ball of wax. And so I say that to say that's part of this change management is like, how do I actually communicate this? How do I give the choice? What are the tools and resources that employees can do? So there's a lot of HR that says, I just made this massive investment a year before, and even though maybe it didn't work, I made that investment, so I now have to stick with this to be able to justify it over the next 3 years versus saying, what, it was a bad move. I should have, let's cut our losses and actually let's do something more innovative. And so to your point on, the inertia of I had to do this, I'm making this decision, and now it's going to take me, 2 or 3 years to move on. So it's really that change management of like, in 25 years, what's going to be happening from that standpoint. So I think that's the ability to be able to say, progression here.
I think I'm going to take this in a little bit of a different direction. I think setting expectations are really important. You all wear so many hats within your organization. You have key stakeholders, you have ownership, CEOs, executive leadership, who have different objectives they want to achieve out of this. You have finance leadership, who's focused on volatility, risk, the financial side of this. Then you have your roles where you're worried about every single person within the company and balancing all the key stakeholders, and you have to drive a decision about one of the biggest line items on your company's balance sheets and take care of people at the same time as doing that. And setting expectations also goes back to if you're going through a change management process, you also have to set the right expectations with all of the employees and their families within your company. And balancing all of that is challenging, but I think it starts with setting expectations with everybody the right way so that people know how to go through the process with you when you make a decision, because there's going to be a lot of them over the next few years as healthcare changes and evolves.
Maybe in addition to just setting expectations, like what are some of the other tactics or practices that you all are seeing employers use to actually do the change management process really well. Chad?
Yeah, I'd say first off, like, you have to trust your employees. Let's start with that. We have so many people. I hear every single day, HR says, oh my God, my employees can't even pick from this one plan design or these two. Now you want to be able to give more choice. Oh my God, they're not going to know what to do. And the employees, by and large, will actually be able to make these decisions. They're humans. They make big decisions at home every single day. And if you give them the opportunity, they will actually be able to do this and do this effectively. So that's where some of the meetings come in. It's not just about like the annual open enrollment meeting where you do a webinar and here's the benefit booklet handout that nobody reads. It's the ability to actually now say, let's give you some one-on-one tools. Let's give you AI. Let's give you the tools to help navigate and figure out which doctors you're going to, figure out which procedures you need, figure out what this is going to look like. So the ability to leverage like technology, teams, communication, that's actually what is going to help the employee make that decision. But by and large, the employees will actually go out there and do a great job, and it'll be a little clunky the first year, but then all of a sudden they're going to say, wow, like I've never had the ability to pick some of these things on my own, and now I have the empowerment to do so. So I would say trust the employees. It will work out.
I think exactly what you said, but I'll add a little twist to that. I think for us, the way I look at it is you have to give your employees a few different things. One is incentives. So if you give incentives, they have to be the right incentives. A $50 gift card to Amazon's not going to cut it when you want them to make a really big change in their healthcare. So have the right incentives in place. That's number one. Number two is give them the tools that they need. They need information. If you think about consumer-driven health plans, you give power to the consumer, but you never gave them the tools to actually make good healthcare decisions. So having the right tools, having the right data, making it easy to understand, giving them education on it. You pair the tools, the data, with the incentives, and then you get that behavior change. So if you add good member experience to that, that makes it easy for the employee to remember, oh, I did this, I got my out-of-pocket costs covered, I had a good experience, I had better healthcare outcomes, and I'm happier person because of it. I'm going to go back again next time and do the same thing because I now know what I'm doing and I know that it's working. So that would be my thoughts on it.
I think you both hit it right on the head. It goes to the heart of understanding your people, understanding what they need, and putting the right solutions in place and working with the Nava team to put the right things in place that'll actually answer to what they're looking for. If you have high turnover, if you are a technology company, if you are a law firm, your people are going to have different needs, so curating the right set of solutions that works for them is important.
Yeah, thank you. I've heard each of you in many ways mention data throughout this conversation. Where in your mind is data moving the needle today, and where do you think the biggest gaps are? Kristen, I'll start with you.
That's my favorite topic, data.
Your softball.
Okay, so the way I would frame data is that it should answer three questions.
Yep.
The what, the why, and the now what. So what means what's happening, what are we seeing? Okay, so in this example, healthcare costs are rising. That's the what. The why. Why is it rising? And I think this is where a lot of organizations fail because they only get to the surface level answer. Oh, MSK, oh, cancer. Okay, well, let's actually uncover that a little bit more and find out what's driving that. If you don't get the why, you cannot get the now what part. So you can't come up with a solution to fix the problem. So if you have the right data, you answer the what, the why, and the now what. I think what we've been seeing as a barrier is that we've been looking at claims data, and that's great because it gives you historic information, but it's not giving you more of that predictive modeling, that predictive referrals that I was referencing earlier. So having the data at the point of service when the employee or the member needs it is crucial. Where we have the data, we need to get to the finish line. We need to get to the end. So let's give the member the data at the right point of time so that they can have the agency to make their own healthcare choices based on data-driven decisions.
Kristen, take on that.
I'm trying to think which way I want to take this. I agree with everything you just said. And also the models that are in place today take away the second two components of that. if you have a large claims report and that's all you receive with your renewal today, and it says neoplasm 200,000, what are you going to do with that? What's the Nava team going to do with that, right? You have to select a model that's going to allow you to see the information you need to make the best decisions for your people. And it's crazy to see how antiquated some of the reporting structures still are in the traditional models. I'll give you an example. If you have a high-cost claimant on plan and it's some sort of autoimmune Crohn's disease, $150,000, $200,000 on there, it's likely driven by a drug called Stelara. There are 20 biosimilars that have come to market, and it's interchangeable at point of service. Mark Cuban's Cost Plus Drugs has a Stelara biosimilar for $360 a fill. That is nowhere near the $150,000 to $200,000 mark, but you're not given the information and resources to actually be able to act and do anything about it. I don't know if I answered the question, but
Absolutely.
But lack of data.
lack of data. I'm not happy with it.
Exactly. Yeah.
Yeah, and in our model, it's a bit different too, because again, you're going to an individual health plan, and now you have to figure out, all right, what are we going to do? Give choices. How do we benchmark the right dollar amount to give to every employee so that they actually understand? Because you're quite literally going to defined contribution. And so a couple of years ago, the only way you could do that was to say everybody gets $500. Well, yeah, as you know, it's the individual plans are now based on the individual in their zip code. So again, the 26-year-old in San Francisco is going to have a vastly different premium than the 55-year-old in Georgia. And so the equity is not there. And the younger employee is going to be like, great, I've got a giant lump sum. The 55-year-old is going to say, well, this completely sucks. I can't buy anything. So the ability to be able to now have the data to be able to say, great, we're going to pick a benchmark plan that everybody can afford. So everyone's going to be able to buy this level of coverage, but now you get this dollar amount, you get this dollar amount, but you can all buy the same coverage. That's actually been a pretty game changer for the ability to say, I'm giving my employees something that they can actually use. There's actual equity there, and it's that type of tool didn't exist until probably like a year or so ago. And that's something that we continuously dig into is if I want to carve out a class. So with ICHRA, you can carve out 11 specific classes and say these employees will go ICHRA and everybody else can stay on the group health plan. So say you have a big population like Georgia and you want to carve out that entire state, you can do that under ICHRA. But again, the tools to be able to do that and show every single employee and what health plans that they'd be able to get. And, does this person have 50 plans they can pick from or 2 plans and it's only the blues and all that kind of stuff. So now the data is there to be able to now actually map that out, show the level of detail and to be able to give you confidence that, okay, this is going to be able to work.
Yeah, thank you. It's a great segue. So we talked a little about lack of data inside of the ecosystem. I'm curious, and this is maybe where, we're all friends here, so if we want to take the spice up a little bit, we can. Let's talk about the other players in the ecosystem, the TPAs, the PBMs, the networks. What would you all like to see from them in this journey? Like, where are they missing in terms of like cost to quality and kind of how you all interact with them? Maybe I'll start with you.
I'm trying to think of how much I should say today. I'll start off with the softball. I think transparency. I don't think that they do a good enough job of being transparent, and I think we talked about it in some of our earlier panels as well. I would love to see them have more of a performance-based reimbursement model. So they're not paying for volume, they're paying for fixing someone's health and getting them healthier. I think that, to me, is something I would like to see them do. Where I'm going to be a little spicy on this is that I do feel that they're really focused on their margins. And when you're focused on your margins, you sometimes miss the bigger picture of what this platform is really meant to do. If the platform is really meant to be healthcare and to help people get healthier, then let's look at it from that narrative and not do a volume play and really help to think through, okay, what are the things that I need to do using my platform for the greater good of Americans? How do I use that? And if you do the right things, the profit will follow. And I think it just takes one carrier, one TPA, one PBM to say, I'm going to do the right thing, and then others will also follow that. So that's where I think that we need to kind of push them a little bit with that transparency.
Kristen?
I agree wholeheartedly with everything you've said. We touched on misaligned incentives earlier. Everybody can make money. Just do it in a transparent way and don't be egregious about it. And there are a lot of solutions set up, great solutions out there, and also solutions that are just focused on a revenue model. If you keep top of mind why you started your business in the first place, you can structure the model. You don't have to have it be the exact same way that all the other TPAs that came before and all the other PBMs are doing things. There's a way to structure this to truly answer and evolve the model forward. And the incentives are the issue, because to your point, if they're just focused on margin and how to drive more profit through their model, that's on the backs of all of you.
Chad?
I think the transparency is definitely the key aspect here for sure. I mean, everything is definitely aligned, but I always say ask your vendor and partner to show their work. If they can't show the numbers and they can't actually show, pop the engine and see how this thing is actually working, then you should probably run as fast as you can the other way, because they're probably hiding that misaligned incentive. They're hiding something that is pretty obviously glaring there. For example, I'll give you a great one from last year. So individual rates only come out once a year, where small group rates are obviously coming out all the time, but individual rates come out once a year. A lot of our competitors just put like this crazy increase without any data. They were just like, we think it's going to be 15% increase across the board, which is a ridiculous thing to be able to say. And we literally had data scientists pipe into CMS, pull the rates. We were looking at the filings. We were trying to figure out, we were working with actuarial firms to be able to say, in this state, what will the increase be? In this state, what will be the increase? How are we going to be able to look at this? We were working with carriers. Like, we had so much data to be able to showcase our work. None of our competitors could do that. And so the ability to say, show your work, where are you getting this data from? If they can't show you that, you have to work with someone that will. So I think the transparency is key.
Yeah, great. The other player in this ecosystem is the broker or advisor, right? And I think, especially as we talk about, Brandon mentioned this a little in the keynote, around brokers, advisors being sort of gatekeepers for a lot of innovation, right? So we're the ones that are sitting at the table with, companies and advising them on what is out there and what they can do to do this. From your perspective, what are the brokers and advisors getting right in this conversation, and maybe what are some of them getting wrong? Just curious. Chad, maybe I'll start with you.
So, I mean, part of the reason I've worked with Nava since you all started many, many years ago is that you challenge your clients to do better and think differently. There's a lot of advisors and consultants out there that if the employer says no, they just say, okay, and walk away. Even though you might be wrong, right? That's the whole idea, is like to be able to say, let me tell you why. Let me challenge you a little bit on, you should look at this alternative. And maybe the data won't play out. Maybe it's a bad decision, but like at least we need to explore it and work together on that. So the ability to be able to work and have that honest conversation instead of just kind of sitting there in complacency, because that's how another advisor will come in and challenge somebody in the right way, and then they're going to say, oh geez, I probably should have listened to something like that. So I think the ability to like bring the solutions to the table, not be afraid to get a no, and just to bring in partners to be able to say, we're going to have a conversation about this. We're going to bring in Garner and Pareto and Thatch to be able to have the innovative conversations. There's a lot of consultants that will never bring us in to be able to have that conversation because they want to do it first. So working with the right partners, bringing in the right subject matter experts. Nobody can be an expert in every single thing out there, which is why you have a great team. So,
Fereshteh?
Well, I used to be a consultant myself, so you have a recovering consultant. I think consultants are doing a lot of things right. I think that, they are now, they've stopped that spreadsheeting, let's just look at premiums and let's just spreadsheet across the board and that's it. Here's what we're going to tell you to do. I think they're now looking under the hood a little bit and really looking at the care delivery model. And I think that's the right approach. So I really appreciate that they're doing that. I think where I would like to see some of these consultants and trusted advisors pause a little bit is the point solution fatigue that's out there. I think that putting 15 point solutions for 15 different diseases is not going to bend that cost curve that we discussed. In fact, what it's going to do, it's going to add more noise. And so from that perspective, I feel like the the best advisors will make the member experience easy. And that's where they're going to really get ahead, I think, in what they're doing. I think every employer wants to put a solution in place that their employees are going to thrive from using. So to not put 15 of them in place, put 1 or 2 or 3, that really makes the most sense. I think that's going to go far.
Yeah, great. Kristen?
I think the advisors that stand up and are not afraid to give their clients a strong recommendation and share with them exactly what they think, and that starts with an understanding of you all and the employees and the clients that they serve. First and foremost, the spreadsheeting, I agree, that's like a thing of the past. It's how the carriers train the market to operate in those 12-month cycles. And advisors who understand the needs of their clients, like Nava, truly look at your short and long-term goals and help you design your health plan and your benefits to truly serve your needs and your people's needs. I can share an example, actually, that one of the Nava team members shared with me, which I'm sharing their story on their behalf, so let's see if I do it justice. When he became a consultant 17 years ago, he got his dad to take him out to his dad's company so he could pitch them on why they should work with him. And they didn't sleep for a week, talked to them about their benefits, and they were very polite, but they said, come back when you know what you're doing. He waited a decade, because this is really important to him, and he went back and he talked to them again about how he could help them really answer to their needs and change their health plan for them. He ended up changing how they finance healthcare. He put in certain solutions that would actually help and answer to what they needed specifically. And fast forward, remember, this is his dad's company, so his mom is on the plan, and a couple years ago, they were at Christmas. Grandma's not really playing with the kids, she's tired, and they couldn't figure out what was going on with her. But it turned out that the recommendation was for her to go on dialysis, but with no actual diagnosis as to why. He had put a second opinion service in place, got in contact with them. They got his mom to Stanford, the CKD or chronic kidney disease specialist there, and they found out that 2 of the medications she was on were interacting, and she would probably flatline within a month had they not caught it when they did. So the decisions you make around benefits and listening to your Nava team and the advisors that you work with is really important, because it can be life-changing for the people on the plan. And, full circle on his story, he got to help his family in a way that some of us can only hope to do at some point, and really helped change the trajectory of a very tragic situation. Listen to Nava.
Love that. Love that. So we got about a minute left, and maybe last question. Kind of bringing it full circle back to this balance between cost and quality. If you were to give the employers in this room any advice on how to maybe rethink that relationship going forward, and maybe a call to action, like tomorrow, when you leave this meeting, what's the first thing we recommend that you do or think about? What would that be? Maybe Chad, let me start with you.
Loaded question. I would say literally talk to your Nava advisor and say, what can I be doing differently? How can I actually look at alternative strategies, and let's do a deep dive on 2 or 3 different ways to be able to skin that cat. Because again, 3 different companies, 3 different very, very different approaches to the market, and which one's right, which one's wrong. Yeah, I think the last panel said whatever the answer is today is wrong next month. Ask the questions and be able to just be really curious. But whatever it is that you're working, if it is working, ask why it's working. If it's not working, let's double down on actually looking at a couple different solutions. So don't be afraid to do that.
Great, thank you. Fereshteh.
Tomorrow, all of you should go and ask your Nava team members and or your carriers, the TPAs, to provide you with data. And I think that the data that you're going to ask for is not going to be your traditional data. What I would recommend you all ask for is looking at data from a lens of a waste analysis. So what is wasteful spending? What can you actually impact? And by understanding that, by understanding maybe even something as simple as provider variance. So if you're not able to understand which providers your employees are seeing and compare the outcomes of those providers to the national averages, then all you're really doing is you're paying for the bill, you're not managing your plan. So I would say go to it with that lens and start that tomorrow.
Probably in the same spirit, maybe ask yourself a question around, are you truly in control of your health plan? Or are you reacting to what's happening in your health plan? And if the answer is the latter, act now, act tomorrow, to your point, to really start to explore what else is there and what will truly answer to what you're looking for your employees and their families.